The member representing Jema'a Sanga Federal Constituency in the House of Representatives, Honorable Daniel Amos, has flagged off the fourth edition of his free medical outreach aimed at improving access to healthcare in the two local government areas. The program was officially launched at Sir Patrick Ibrahim Yakwa Memorial Hospital in Kafanchan, with parallel activities taking place at the General Hospital in Gontu, Sanga Local Government Headquarters. Organizers say this year's medical exercise targets 1,200 general surgeries, 400 eye surgeries, and the distribution of 3,000 pairs of eyeglasses, making it one of the largest medical interventions in the area. The program is fully funded by Honorable Amos at an estimated cost of 150 million naira in partnership with the Graceland Healthcare Foundation and supported by medical professionals and volunteers. Speaking at the event, the lawmaker said the program, which began 3 years ago, was created to bridge healthcare gaps in undeserved communities and has so far reached thousands of residents.
Vision and mission is the same. The intention from the one is very clear. So it's an intervention that for me and my team, and of course the government and people of Kaduna State are very proud of. This is what governance is said to do. This is one of the reasons why there's government, so that at every time you intervene for your own people, especially those ones who can afford to pick up these bills ordinarily. Like we started 3 years ago, in the first edition with 400. And the numbers that came out were so much that the second edition, or rather overwhelming, so that the second edition we had to up the number. A third edition, the same thing. Today we are targeting on this edition that will run for 6 days in different centers across the federal constituency. We are targeting 1,200 general surgeries and of course about 500 eye surgeries. We are also distributing over 3,000 reading glasses. So the number will continue to increase. We are still on earth. Let me be a bit spiritual. It's only in heaven. But when we get to heaven, there won't be sickness. As long as we live here, people will be sick. So, unfortunately, in this circumstance or instance, the number will keep increasing because you're going to have more people that need medical intervention.
Representing the governor of Kaduna State, Obasani, the director of hospital services at the Ministry of Health, Dr. Jonathan Gajere, commended the initiative, describing it as consistent with the state government's health reform program.
His Excellency has about 4 messages. The first one is to congratulate the Honorable for that initiative. That initiative is in line with His Excellency's sustained agenda to ensure that the people of the state are rich. They should have access to health care, and if possible, at little or no cost. The second one is to bring to the notice of the people of Kaduna State, especially Jema'a Sanga constituency, that the state government is doing a lot in terms of renovating all our healthcare facilities, primary healthcare centers, and secondary facilities. Not renovation, be renovated, equipped. That is what is happening. Evident by where we are today, this facility is befitting. I think that's why the federal government got attracted and they are taking it up as a federal medical center. So he's also congratulating for that. The third is to actually congratulate the people of Southern Kaduna for what the politicians and their representatives are doing, both at the state level and at the national level, and to give them all the cooperation to enable them to do what is interesting for the people, the generality of people of the state. The fourth is actually to seek support. To seek support, to be very vigilant in all we do, and continue to pray for all of us, for our leaders.
Also speaking, the senator representing Kaduna South, Sunday Marshal Katun, urged residents to take full advantage of the free services, describing the program as a true reflection of the dividends of democracy. The project coordinator, Dr. Ibrahim Mohammed, confirmed that rural communities including Kagoma, Gidanwaya and Jagindi will benefit from the outreach, which is expected to run for 6 to 7 days.
Wannan aiki da muke yi kamar yadda kullum ake faɗa, na san kuma Honorable Dan Amos ya faɗa, ba a an san ko sisi a hannun wani. Duk wani wanda ya zo ya same ka ya ce ka bada kuɗi, akwai officials, akwai mu da muke gaddamar da wannan aikin a sanar da mu. Wannan aiki kyauta ne. Alal akalli a wannan mazaɓa ta jama'a Sanga kusan sama da mutum 10,000 sun ci gajiya ko za su ci gajiya yanzu aka karasa da waɗannan. Wannan abun alfahari ne, abun murna ne. Ina muku murna, ina muku fatan alkhairi. Da fatan